This podcast is on what I call the deep neck lift. And the deep neck lift is basically a lift that is actually good for almost any age. It can be done in a 16 or 17-year-old person, or it can be done in a 80-year-old person. So a lot of times when we hear the word lift, we immediately associate it with someone older that, if it's a deep issue, then probably someone needs to be at least 65 years old to do it. But I can show you a 70-some-year-old person or even older that I just do a standard lift on. So what does the lift entail? Who is it good for, and what are the accomplished goals? So first of all, let me tell you what a deep neck lift is not. It's not a superficial liposuction. So we first have to understand sort of the anatomy of what's going on and what people are trying to accomplish with procedures that truly fail. So a full neck, a neck that really just looks too full, and you need to improve that, and people think it's just liposuction. So how do you decide if someone needs a standard lift or a deep neck lift? Very simple. If I pull up the sagging tissues, if it's someone older, for example, and their neckline looks pretty right angle and straight, then most of what they have there is not an excess of deep tissues. They just have a saggy fat or saggy muscle that just needs to be lifted with a standard deep plane facelift. But a deep neck lift, the way that I can tell, very simple, was whether you are 20 or 80, is when I pull back on those tissues and I still see fullness there, then I know a standard lift won't work. Now, let me clarify one more thing. If I'm dealing with someone under 40 that doesn't have a lot of sun damage, usually it's the right thing to do. If they have a full neck, obviously they're not having a sagging neck and they don't need to have a facelift per se. So that's usually very rare that I would be doing a lift, and a standard lift in someone under 40 some years of age, because they just usually don't need that. So what I'm talking about, let's say if someone comes to me under 40, I pretty much know that fullness in that neck is going to be excess tissue that needs to be improved. But someone at 60, the first thing I do to determine this is I take both hands and lift up the neck. And if I see that their angle is 90 degrees, then I know that they probably do not need a deep neck lift. But if I lift it and it looks like nothing even happened to their neck and it still looks 45 degrees, in other words, it doesn't look elevated, then I know they have fullness in their neck. So let's first contrast this procedure against liposuction. What is liposuction? Why does it fail? And what is going on? So there are two compartments of fat. There's one fat that's above or inside the platysma muscle, that is deep. And then there's a superficial layer of fat, which is also known as subcutaneous fat. That's a fat that sits underneath the skin, underneath the outer skin. And that outer fat is what people do liposuction for. They suction that fat out all the time. That fat I rarely touch, and the reason for it is a lot of reasons. First of all, it doesn't do anything. So if you liposuction that, and if you've already had a liposuction in the neck, you probably realize it just gave you a little bit of benefit. But it didn't really get your neck as good as you would want. And the problem is after the age of 40, liposuction in the neck causes a lot of harm. So that beautiful outer fat layer, that wrapper, is something that really shouldn't be taken away because it can over-skeletonize that area. It can actually show irregularities deep down. So it's an area that you don't want to remove. Plus, as I said, it just doesn't offer very much. So what happens is if you remove that fat, I had a lady literally yesterday, a nice lady, a Hispanic lady from another country, who I told her about all this deep neck lift, and I said, liposuction really doesn't work. And she goes, yeah, I've had it done. And I was wondering why I could see like the outline of her glands on the side. I could see the muscles, and she had a pretty nice neck. So it actually aged her, because when you take out that superficial fat, not only do you not get a really good result, but then you start exposing some deep neck issues where you can start showing those bands. What are those bands? If you think of it, we call it colloquially a turkey gobbler neck. Usually in fair-skinned individuals, there's those two vertical bands that hang down the middle, like a dog, if you will. My dog, who's only 2 years old, has those two bands. And those two bands become exposed through liposuction. So Ulthera, Thermage, fat-dissolving things, Kybella to dissolve this, liposuction, are all problematic. They don't add anything. If anything, they're going to make things worse. Now, if you've got a 30-year-old that has just a little bit too much fat in the neck and they want fat removed, then liposuction can make it temporarily look better, but it really condemns them to serious problems as they get older if you're overzealous with that liposuction, because that is really going to create these premature visibility of those bands. So if you're younger, you may not show those bands for 10 years, but before it would have taken 30 years. Now you've made it half the time. Maybe it shows up in 15 years. So in general, Kybella liposuction in the neck is really a no-fly zone. It is not a good thing to do. It is not appropriate and doesn't work. If anything, it's going to make things worse. And it also makes my surgery more difficult because it's going to lead to more scarring in the tissues, which can lead to more recovery time. It's just, in general, not a good thing to do. So I hope you understand, if you don't want to do a deep neck lift, whatever reasons you have in your mind, do not do a procedure of just liposuction. I think it's a major mistake. So let's talk then about what are the structures here. If I'm not suctioning fat out from outside the neck, what am I doing? So I am actually surgically carving out the deep fat. So there's a component that sits inside the muscle that is called sublatissimal fat. That fat I don't always remove. In fact, I had an African-American lady I just did a deep neck lift on 2 weeks ago. And I thought she had a very full neck. I said, my God, she's got to have a lot of deep fat. She didn't. She had what's called digastric redundancy. So these muscles that really don't do anything. We don't have these muscles don't really add anything. They don't make you function better. But she had some digastric muscle fullness, and I carved that down. So what do I take out of the deep neck? It's what is contributing to the full neck. So it usually has to do with three major structures inside this deep neck area. Deep neck fat, which I alluded to, which is usually a midline, just off midline fullness. Digastric fullness, which is usually midline to slightly off midline. And then submandibular gland fullness, which are fullness on the outer portion of the neck that causes fullness there. Now, the mistake and the hard thing to do is for a doctor to take out the submandibular gland. So the mistake is for someone that says, a surgeon says, I can take out deep neck fat. If you just take deep neck fat out and leave everything else alone, don't touch the glands, you're going to create what's called a cobra deformity. So if you think of what a cobra animal is, or a serpent, they have this hollowed out center and they have the two sides being overly full. And that's not a good look. It's not a good combination. So in a deep neck lift, you can't just take the deep neck fat out. You can't just carve out some digastrics and call it a day. You've got to work laterally or toward those glands. So what are these glands? So they're called submandibular glands, also known as submax glands. They're salivary glands. They help make saliva. So the natural question when I say I'm going to take some of these glands out is, will this cause dry mouth? And what's interesting in the ENT literature, they've shown that if you take out actually both entire glands out, that there's really no dry mouth. Now, it's only dry mouth if they had cancer there, you took out both glands and you did a radiation in that area, then that's a different story. But it's not cancer, I'm not taking out both glands, and I'm not irradiating. And the amount of the amount of the gland I'm taking out is only about 30% of each one, just the part that hangs below the jawbone or the muscle of the mandible. And we also have like 600 to 1,000 minor salivary glands all over our mouth. Across our buccal area inside our mouth and along in our lip and our tongue and everywhere. We also have two big parotid glands that produce about 70% of the watery portion. Of course, I'm not touching that. That's on the sides of your face. And then you've also got two glands underneath your neck or inside your mouth going into your neck called the sublingual gland that doesn't contribute any negative things, and I'm not touching those either. So bottom line is I'm taking a very small fraction of the glands, should not be an issue. The other thing, and I always reference this, Dr. Google, in other words, Google will tell you all these things that scare you, like it's very dangerous to take out the glands because there are nerves around it, there are major bleeding and major salivary leaks where the leaks can occur, and that's all true. But it's not entirely true. So first of all, if you go to a surgeon that doesn't know what they're doing, I've done 4 of these in the last 3 weeks, so I do quite a few of these. But if people say, is it dangerous? Well, I know the anatomy very well. And if you stay intracapsular, in other words, you're inside the capsule of the gland, it's very clear, then you know that you're safe because the nerve and blood supply, everything is outside of the capsules, above the muscle, far away from where I'm working. The second thing to understand in terms of bleeding and salivary leak is I use a device. It's super expensive. My machine costs me over $20,000. My disposables are $1,000. Essentially, this device is called a Covidian clamp, and they use it now for tonsils. And if you've ever had your tonsils out or understand what a tonsil removal is, the risk is bleeding afterwards. And they use it. My father, my stepfather, who's a retired urologist, says, "Oh yeah, I used to use that for doing a prostate removal because there's a lot of bleeding." And so in the past, I used to do this procedure just with a cautery device. And fortunately, I didn't have any major issues with bleeding or salivary leaks, but there's always a risk. But now with this device, instead of cauterizing it, if you over cauterize something or under cauterize, and you don't know how much cauterize, you're just sort of cauterizing things, and there's a natural tendency to over cauterize, the cautery can fall off, you can have bleeding later on. This device uses a low impedance method, and it actually seals the gland. And you hear this go deet, 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 deet. And when it has a high, long sustained deet, it means it's safe to cut. In fact, it comes in with a built-in cutting device, so that it cuts on the side of the gland that's being removed, and the other part is completely sealed. So I just progress across the gland and have this way to remove it in a very logical, logistical fashion. And so the deep neck lift essentially is a combination of some gland work, some deep neck fat, some digastric shave, maybe some myelohyoid, which is a deeper neck structure. Usually you don't need to get down to that level. But those areas I'm just carving. It's like if you're doing sculpture work, you're sculpting. So if you've got a very full neck, and sometimes I do take out some superficial fat. It's just typically very little, and it's usually not the major issue. But sometimes I do take some superficial fats. It's the problem is just taking that superficial fat, taking too much of that out, it doesn't do anything and causes problems, is sort of my point of this. So the deep neck lift, after I've done all that, I then tighten your muscle called the platysma, and I anchor it to the deep fascial layers along what's called the hyoid bone to reconstitute that sort of right angle. And so I do that for a 20-year-old, I do that for an 80-year-old. But the difference with the deep neck lift and what's called a deep plane facelift, which you can listen to my other podcasts and blogs on this subject, which I'm going to briefly touch upon here, is that the deep neck lift in a patient, let's say, I'm just going to arbitrarily say under 40, is all I do for them. Whereas someone, let's say 45, 55, I will combine it with a lift. Now, if someone's younger and they've got some sag in the jawline, I'm going to do the lift with it. So it's not hard and fast that if you're under 40, I'm not going to do a deep plane lift with it. But in general, if there are signs of aging, the deep neck lift will handle the neck, but it's not going to handle the sagging of the neck completely, and it's not going to handle the sagging of the jawline and the midface. So that is what's called a deep plane facelift. And so, again, an easy division is if someone is under 35, 40, or 45, whatever it may be, then in general, I will be doing a deep neck lift with a deep plane face. Sorry, if someone's under that age, I'm just doing a deep neck lift. If someone's over 40, 45 or so, I'm going to be doing a deep plane facelift with a deep neck lift. So what is a deep plane facelift? So you don't have to hear the other podcast. Essentially what I'm doing is it's like a standard facelift, but I'm releasing some deeper ligaments. There are ligaments that need to be released. If you don't do it, you do a standard facelift, you don't get great results in the midface and in the folds in the jawline, and you don't get durable results. So my technique of releasing these ligaments, again, I'm not going to go into detail, provides a much more durable, much more natural, much cleaner, longer term result. And I combine that with a deep neck lift for someone that's beginning to sag in this area. And so that's a sort of a component of the whole procedure that I'm doing with someone that's slightly on the older side. Even in their 40s, most times I would be doing the combination because it doesn't add much recovery time to the equation, which we'll talk about briefly in a moment. And so the deep neck lift and the deep plane facelift are sort of cousins of each other. But if you have a full neck and you lift the side tissues, you're just not going to get the improvement in the neck contour as good as possible. I would say about 50% of my patients I'm doing a deep neck lift on, 50% I just need to do the deep plane and they get a good enough result. It has a lot to do with their neck anatomy. And again, the easiest way for me to tell is I pull up on the sides, I look, and I get a great read of what is going on with the neck. In terms of is it just saggy muscle and saggy skin, or is it really fullness of the gland and fat that needs a little bit better carving to get that result as tight as possible and as good as possible? If you do a standard lift, you probably get a pretty decent result from the frontal view, but if they've got fullness on the side and you look at the side view, it just looks inadequate. It just doesn't give you the angulation, the shape that you really are desiring or wanting for you as an individual. The recovery is pretty straightforward. It's if you look at your friends who've had even a standard facelift, they look black and blue for 6 weeks. My patients just don't look like that. There is a drain on the back of the ear that stays in for a week. The reason I leave it in there is that I don't want, even though I really have never had a salivary leak from the subnibula gland. I've had a couple in my history, and from the parotid gland, it's not that common, but from the subnibula gland, I've never had it. I've done quite a few of these, but I leave it in there just in case there is oozing that I need that for, and so I leave that in there for in that area. But anyway, so I leave that in there for a week. It doesn't hurt when it's there. It doesn't hurt when it comes out. It's sitting behind the neck. That is something that doesn't look attractive, but I leave it in there. I take it out in a week. And most of my patients, believe it or not, even if they're swollen, they still look so much better, even swollen, than they did before, because I've taken those deep structures and elevated them. So yes, there can be swelling. There can even be mild swelling in a month, but most of the distorting swelling is improved for most patients in the first 7 to 10 days. But as I said, even when the swelling is there, because I've removed so much of the deep structures that are sagging, their neck looks so much better that even with some swelling, it still looks better when they started. And it's easier when you come in for consultation, if you haven't been in for consultation, for me to show you examples, photographic examples, walk you through it, so it's more crystallized than what you're hearing from an audio podcast. But it still gives you the concept of how I do it. And probably about 0.1% of surgeons out there do this. And it's just something that is harder because anatomically people don't understand how to do it. But the deep neck lift, again, is good for younger to older. It's good for all situations. Sometimes I'll combine it with a chin augmentation or chin implant, because sometimes you not only have a very saggy neck, but you've got a weak chin, and that just gives me the best distance to cover and to make that shape really, really elegant. I don't always do it. Sometimes I do it. And a chin implant is I do in about maybe 10 to 20% of my lifts to get a little bit better neck and jawline work if someone's got a weak chin. But to me, it's a no-brainer to get that done. So this is a somewhat quick 17-minute overview of a very complicated subject, but it's one that I think is helpful for you to understand what I do, and it gives you a better impression of understanding how I decide between a standard lift and a deep neck lift.